Okay, the machine is finally ready, and my husband's getting ready to stick me. He's got to get all the air out of the lines. As you can see over here, he's putting his gloves on. You have to be very sterile. That's the filter. You make sure you get all the air out. And he'll be priming it here just in a few minutes. Show you all how he does that. Get up here close enough. Okay, just unscrews the top there a little bit, as you see. Let a little water drip through. Let him sit back up. Okay, and here's where he's shaking the lines. He has to shake the red and the blue at least 2 to 3 times to make sure all the air is out. Just letting you guys know, I finally am on the transplant list at Kentucky University, waiting on a kidney. Okay. Here's where he's going to enter the numbers. I always run at 1.50. And he just takes that up as far as it'll go. Okay. He toggles over. And I'm taking off 3 pounds, so it'd be 3.0. Okay. And I'm gonna have to go wash my arm while he. Well, let's get the rest of this before I wash my arm. He's making sure that the pressure pod's connected to it and that all the lines are unclamped. You cannot touch the ends. If you do touch the ends, he would have to start all the way back over. It has to be very clean and very sterile. The white ones stay clamped. That's my saline in case I need some during treatment. You know, if my blood pressure bottoms out, I have to get some saline. He's hooking up the dialysate now. And in just in a few minutes, I'll show you the waistline. The waistline runs into the sink and out. It's all the waste that comes out of my body during the treatment.
It don't matter if it touches.
As far as the waistline goes, if you touch it, that'll be fine because that's not touching my, going into my system or touching me whatsoever. Okay, he's just turned the dialysate machine on. And he's just going through checking everything, making sure everything is. Here's my syringes he has to use to suck my blood out, which I'm going to try to get that film for you guys. And may God bless you all. I'm going to go wash my arm now. I don't know if I can film that and wash my arm too to show you all how I wash my arm. So here we go, over to the sink. Take my plastic off. This plastic, what it does is hold your numbing cream. Some people use numbing cream, some people don't. I I've not really got a lot of scar tissue build up right now. Most people do, and it doesn't hurt. So, let me get me a couple of paper towels. Dry my arm off. I'll just come over here to the sink. Get some water going. Get some soap. And just wash it real good. I'm going to get all that off because if you don't, you could get an infection in your arm. I know there may be some people out there right now watching this video that is on dialysis. I know what you're going through. I pray for you. Okay. Now, let's get my arm dried off. And we can get it filmed of me cleaning it. Okay, first of all, let me put me a glove on. Because that betadine stuff, you do not want to touch your arm. So, get your betadine out. Okay, just rub your arm down with betadine real good. Throw that away. Get your alcohol pad. And just wipe that off real good. Make sure you clean that arm good. Okay, done with that. Okay, and he is ready to stick. So let me lean back here. Look, he'll straighten up. Have to get kind of comfortable sitting here 3 hours. It's hard on you. Okay, he's going to hand me the camera over now, and I'm going to film him sticking my arm. Well, good view. Oh, right there's a good view. If he can stick me right there.
Making all the band-aids out.
Just getting some band-aids out. Hold the needles in.
You got no diabetes, no high blood pressure.
I have no diabetes. Pretty healthy as far as my back and one of my leg hurts, but this hit me, you know, just all of a sudden. And so, as you can see, that's not too pleasant to look at, but there's a lot of patients that need to see this. Those that are not on this should take very good care of their kidneys because they don't want to ever be on this.
Here we go. them too tight.
Okay. This is where he primes it to make sure that the needles are in there right before he hooks me to the machine. If they're not, it'll hurt majorly bad and blow the vein. That one was good.
Then we have to re-stick.
And let's see how this one does.
Can't give the eye.
Now see all that air that's in there? That has to just be thrown away. It can't go back into my system. So, now that he's done with that, he'll get up there and get his hoses to hook me up. Red goes to red, blue to blue.
If you touch that tip to anything, you have to stay there.
Okay. I didn't clamp those. Okay, now he's fixing to start it up. I'll let y'all watch the blood run through here. As you see now, the hoses are clear, all except for what he stuck in my veins, but in just in a second, you'll see blood run through
Don't forget your dip.
the other ones. Okay, there it goes. Went through one, and here's the other one.
One pour, one goes in.
You'll see some blood through it just in a second.
Show you filter.
Okay, there it goes. Okay. I don't know if I can see the filter or not. I'll show you all the filter.